Exercise rehabilitation is a modern approach to recuperation in patients who are suffering or recovering from chronic diseases, injury, or surgery. This presentation endeavours to cover the benefits, motivators to complete, and perceived barriers to exercise rehabilitation. The main goal is returning to pre-incident functioning. Its prevalence is gradually growing, however, occurrence is reportedly low in chronic disease groups, particularly cardiac and cancer patients. Exercise rehabilitation has many benefits for chronic disease patients. Immediate benefits include reduced blood lipids, blood pressure, glycemic control, insulin sensitivity, and fatigue post-treatment. Further prolonged benefits may also include reductions in body weight, BMI, HDL cholesterol, and insulin resistance. Improvements may also be made in muscle strength, cardiopulmonary functioning, and quality of life. Many motivational theories can be applied to this population as to the reasoning for completing exercise rehabilitation. Self-determination theory addresses the requirements for three innate psychological needs: competence, relatedness, and autonomy. Ryan in 2000 noted the greater adherence rates to populations who are internally motivated to complete rehabilitation. Using self-determination theory, chronic disease patients may be more motivated to engage in exercise rehabilitation if their competence is adequately challenged, in addition to an increase in autonomy. Theory of reasoned action suggests that people's intention to complete behaviour is the most prominent factor in motivation and adherence, and is comprised by attitudes and subjective norms. Behaviours perceived as positive will have greater motivation to engage. Theory of reasoned action may be a motivator due to positive nature and outcomes, such as weight loss and autonomy. An extension to theory of reasoned action, theory of planned behaviour, suggests intention and perceived behavioural control are the most important motivators. If patients perceive the rehabilitation program to be within their range of difficulty, they will have greater motivation to engage. Finally, trans-theoretical model proposes that those changing behaviour experience a series of stages determined by their readiness and motivation to change and engage. Marshall and Biddle in 2001 noted that patients who have greater motivation have a greater likelihood to smoothly move through the stages, with greater success in action and adherence and less chance of relapse. Other patients may perceive motivational barriers falling into categories of socioeconomic, condition-related, and patient-related factors. Mechanisms to remove barriers include increasing social support, use of financially friendly options, education and tailor programs specifically to the patient's disease state, and allowing for adaptability. Perceived barriers can be broken down by motivational interviewing, which is an effective strategy conducted between patient and provider. It allows explanation of appealing benefits, including self-confidence, improvement in self-image, and social interactions. Motivation to engage in and complete exercise rehabilitation is important for chronic disease patients. Many motivational theories can be employed to explain motivations, however, several motivational barriers still remain for some patients.